Hello everyone, my name is Dr. Adenike Eketunde and this is Health Domain. On this show, we'll be talking about health and general well-being. We will also be debunking medical myths. Today's topic is plastic surgery, a new era in Nigeria. We'll be talking about plastic surgery and everything you need to know about plastic surgery. And we have a special guest here today. He is the famous surgeon that did the plastic surgery on Toto DK. He will be enlightening us about plastic surgery. Stay tuned, we'll be right back.
My name is Dr. Aranmolate Ayobami. I'm a plastic surgeon. I work with Grandview Medical and Laser. I'm certified plastic surgeon with the West African College of Surgeons. I had my university education in Nigeria, College of Medicine, University of Lagos. I also did my postgraduate training here in National Orthopedic. However, I've had a lot of overseas training, starting with a clinic in Sweden called Academic Clinicing. I also had training in burn and wound care in St. Elizabeth's Regional Burn Center, Nebraska, USA. I'm also an aesthetic medicine physician with the American Academy of Aesthetic Medicine. I did some training also in South Africa as a laser surgeon, also on chemical peel radiofrequency and some small device. I also had training in rhinoplasty in University of Southwestern, that's in Texas, USA. So I've had a lot of talks on plastic surgery, and I'm still doing that. Thank you.
Welcome back. We have our special guest today. He is Dr. Rasheed Aranmolate, and we'll be talking about plastic surgery. Welcome to the show today.
Thank you for having me on your show.
Okay, we're going to start by telling us what is plastic surgery.
Well, I'll quickly want to introduce myself. Like you have rightly said, I'm Dr. Aranmolate. I'm a consultant plastic surgeon. I also do a lot of work when it comes to aesthetic work. Definitely, we are actually a team of plastic surgeons that have decided to change or bring a new horizon to plastic surgery in Nigeria. Definitely, plastic surgery has existed for a long time, not only in Nigeria, but definitely abroad too. However, in this part of the world, we are just trying to bring that change, make people understand clearly what plastic surgery is all about. Now, actually, if one should go back to history, the first documented evidence of plastic surgery was in a place called Sushruta, a book called Sushruta. In India, but later on it was exported to Europe. Then we have some contemporary from America. America is referred to as the new land. However, in Nigeria, we have some people in the past who have actually done plastic surgery. We are just the new generation of plastic surgeons that have decided to make that change. Now, the word plastic surgery itself is the word plastike. It's actually a Greek word. It means malleable, reshape, remodel, So that's basically what plastic surgery in the simple words means. But to the general public, when they say plastic surgery, a lot of people always think about, breast enhancements, nose job, and a lot of things like that. But definitely that might be totally wrong because those areas they are talking about, they are called the cosmetic part or the aesthetic part. However, the real plastic surgery work actually is reconstructive. A lot of our works are actually reconstructive, which is about 90%. Less than 10% of the work is the cosmetic surgery, which is the one they are all familiar with, because we have a lot of plastic surgeons in different parts of the country, usually the teaching hospital, where they do a lot of reconstructive work, starting with something like wound care. You have patients with traumatic wound or malignant ulcer, and you have an ulcer you want to cover. That's the work of a plastic surgeon. So we basically work in every department of surgery, starting from the head. You can have a patient with a trauma, with an avulsion of the skin of the scalp. There's also in the neurosurgery unit. It's the duty of the plastic surgeon to rotate some of the skin around the scalp to cover those defects. You can have someone who has an avulsed nose. You can have someone who is involved in a fight and someone took off part of the nose. It's the duty of a plastic surgeon. So we can go on and on. Like that. And then to talk about the aesthetic parts, things like the breast. Okay, after a childbirth, my breast is saggy. Doctor, what can you do? Those are some of those things that we do as plastic surgeon.
As a plastic surgeon, you talk about the different types. We have the reconstructive and the cosmetic surgery. And the cosmetic surgery says about 10%.
Yeah, less than 10%.
Less than 10%. How common is cosmetic surgery in Nigeria? Like,
Well, I wouldn't say it's not common, because in the past it has been something like hidden agenda. It's something that is not, like a secret. Just like in the past when I was growing up, seeing a woman wearing a trouser is like a taboo. But after some time, you see time changing, people involving. So definitely, cosmetic surgery has existed. However, for a lot of people in the past, the story is that, or what we know, is that many people go abroad to do the cosmetic surgery. But I grew up knowing my uncle, who is also a plastic surgeon, doing some of these procedures, because I do go to his clinic when I was in medical school, and I do see some breast job being done, some nose job being done. Not something unpopular, but because of the media age, I think the media actually brought out more things to the public, so that even when something is done in the secret, it is seen in the open because of the media age, which is not in the past. In the past, we are all restricted to reading the newspapers, but even now, the newspapers are on the internet, which basically you can use. I would say it's common, yes. Maybe affordability is always the biggest problem, because if you look at the amount of people who want to do cosmetic surgery, there are a lot more people. However, maybe they cannot, not all of them can afford it. At that point in time, it will be very difficult for us to say precisely what is actually happening, to get a true figure. But in terms of how many people really desire to have a cosmetic surgery, I would say more than 10% will probably want. However, maybe in terms of affordability, I would say maybe 5% of the population will fall in that group, or probably less.
so what are the procedures you do in cosmetic surgery?
Well,
because I know there are a lot of procedures there,
yeah,
plastic
definitely.
surgeries. So what are the procedures that you commonly see at your clinic?
Well, I will simply want to divide them into two. We have the non-invasive and we have the invasive procedures. When we say the non-invasive, we talk about things like Botox. When you have people with facial wrinkles, I have done Botox before, where you notice people, like I'm doing my face now, you can see the wrinkling, we call it dynamic wrinkle. So with Botox, you can actually put some Botox, and that will be taken care of. And in that way, you reduce your aging by your look, not by your age. You can have things like derma fillers, whereby people with prominent nasolabial fold, they come to you and say, doctor, this thing is just too prominent. Can you do something about it? Then definitely, there's the concept that there's a product called a derma filler. You can also use fat to do the same thing. So we do that. Those ones are the non-invasive type. Then we have the invasive type. Could age start if we start with the face also, we could think about something like lip reduction. But these are some of those things we see. Not so many, but we do have one or two people who come in for a lip reduction. You could also have a nose job. Someone come here, oh, the base of my nose is rather too wide. I want to reduce the base of the nose. Those are some of the things. We could have something like cleft ear after maybe he wearing a heavy dangling earring, and either the pierced part is too wide or it has cut through. So you want to repair that. Then you go to the chest area. You have, for a lot of women, is either the breast reduction. They have this huge breast that they are comfortable with a lot of back pain, bra strap, injury.
So people actually come for breast reduction,
Yeah,
breast enlargement.
Definitely. A lot of people do come for breast reduction.
Is it in this part of the world?
Yeah, definitely. I'm talking about Nigeria. I'm not talking about...
So Nigeria, they come more for breast reduction than breast enlargement.
Well, sometimes, when we say reduction, enlargements, these are terms sometimes that goes into each other. Now, for a mother that have had children, sometimes they could have a big breast. However, it's so saggy. Now, when you do a lift, the lift could actually be accompanied with a reduction or just a simple lift. I hope you are getting what I'm saying. Meaning that, the nipple is all the way, it's playing all the way down. Now you want to take it back to Arsenal. Maybe it was in Chelsea, and say, oh, please come back to London. You want to make it better. So that's a lift. Now, you could have someone who has very huge breasts because it's uncomfortable, her breast size is difficult, her back pain. That one, you do a lift and a reduction. So you're going to take out of the breast tissue and put the nipple in a new nipple position. Now, we also have some people that they've lost volume of the breast and they want to increase the size of the breast. So those kind of people will come to you and say, ah, doctor, this breast has really gone down, or they never had good volume of breast. You examine them, you say, oh, this one, you have two options. You have the option of fat transfer to your breast, or you have the option of silicone implant. However, for the fat transfer, we always tell them the result is not usually fantastic. So a silicone implant will definitely be a very good option for you. So we'll do some measurements either using our a 3D camera. There are other software we sometimes use. Then we'll decide the best size of implants to be used for such a breast. Then we'll go ahead and do the breast.
All these procedures using fillers, adding silicone to the body, injecting foreign materials into the bodies, do they have actually side effects, or is it dangerous to the body? It's not just for the cosmetic and the outside look. Is it dangerous?
You know, sometimes when clients come to the clinic and ask me the same question, I said, do you think I want to lose my certificate? The answer is definitely no, because I definitely want to practice for a little longer period of time, you know, as long as I can. So definitely there is no doctor, except the person is a quack, that will do anything that will be or put the patients at danger. Now, however, for a lot of procedures, there could be some problems or complications that could arise from the procedure. It's just like when you are to fly. Some people, when they fly, they have this flight problem. You know, they start vomiting. You know, sometimes you could have your hair like. So that's how it is sometimes when we are doing cosmetic or plastic surgery procedures. You could end up with some scars, yes, which is acceptable. Just like I say, no pain, no gain. So some of the scars will get far better in the future. But definitely, we'll say complication can arise. Yes, scarring is part of the complication. Like in patient with liposuction, numbness, we generally will be restored back. You could have redness, you could have bleeding under the skin. So those are part of the complication that could arise from doing one or two procedures. Yes, sometimes you could have a patient with a disastrous complication, but the beauty of it is that you as a surgeon, it's not for you to run away. You know, sometimes you could make decision and you realize that it didn't turn out the way you wanted.
Situations, they are not life threatening.
No. Now, there are some of the complications that could be life threatening to the patients. And oftentimes, as a surgeon, it is your duty to ensure that you avoid some of those things from happening. Like option of using what we call compression stockings and things like that, in order to avoid deep vein thrombosis and things like that. So even when they do happen, it is your duty as a surgeon to handle the whole procedure or the whole process the way it should be done. Okay, you have patients with a deep vein thrombosis. What's the next thing? Or you want to transfer the patient to an ICU. You want to give specific drug to help to break the stuff.
What can the patients do to prevent these things?
Well, sometimes some of those things are not part of what is in control of the patient. What a doctor or a surgeon has control of is to ensure that the patient is the right candidate for the procedure. That is the most important thing. Because, like, okay, let me give an instance. I had a client that came in and she has had 3 episodes of what we call deep vein thrombosis. Now, I clearly told her that this procedure you want to do, because she wanted to do a tummy tuck. I said, this procedure you want to do, because of your past history of deep vein thrombosis, I want you to sign an extra consent because you could die in the process of doing this procedure. Now, the whole essence is that, you see, the procedure she wants to have is not going to kill her. However, it is also my duty to educate her that on a normal day, you have this deep vein thrombosis. Now, this procedure will put you at more risk because you are probably not going to be mobilizing yourself as usual. So those are the education you have to give to the patient before they take the risk of the procedure. So that's how it is.
Okay, thank you so much, Dr. Rasheed. And we'll be talking more on plastic surgery. Stay with us. We'll be right back. Welcome back. We're still talking about plastic surgery with Dr. Ayo. Please, can you tell us, would you consider yourself a celebrity doctor?
Well, I don't know what celebrity actually means. Yeah. But I know definitely what you mean by celebrity. But for me, that's the last thing I actually think about, because for every day that I wake up, you know, I'm grateful to God for the last surgery I did. So because there's another one that is coming, you know. So I don't look at things in that direction. I don't even bother myself to think in that direction. I'm happy for the success God has given to me, because sometimes when I look back, and I consider what I presently do, I'm just happy. When people celebrate me, yes, definitely I accept the challenge, but it also means that I have to step up my game. That's the way I see it. He said, to whom much is given, much is also expected. So for me, I think that's the last thing everybody should talk about. I think there's still more ground to conquer. Yeah.
So you've been working for years. Have you ever done any procedure that has gone wrong and you've been so scared that this is it?
Well, I wouldn't say I've done any procedure that have gone wrong. When you grow older as a surgeon, you also learn better ways of doing a particular procedure, because the more you do, the better you become. You can only modify what has been done. I would say there was a particular case that I did that I was scared, and that was even when I was in training. Because we had a boy, I think he was 12 years old. He had a stab injury to the elbow. Now, when I saw him in casualty, when we were to examine him, immediately because they did what we call pressure dressing on him. Immediately you remove the pressure dressing, it was pushing out blood like tap. I knew quite right that, it's going to be a vessel that is involved. As a plastic surgeon, we're also trained to repair vessels. So my boss told me, go ahead, Dr. Aranmolate, go ahead and do this case in theater. Now, there are other things or principles that guides when we have to work on the limb, which is what we call tourniquet. Tourniquet, I'm sure everybody is aware of the word tourniquet. We just apply something above, like a pressure, But in our own case, we have surgical devices that are supposed to be like the tourniquet that does that. When we got to the theater, I applied the tourniquet. I didn't know the tourniquet has failed. So I realized the child was bleeding. I told the anesthetist, just hold on, let me reapply the tourniquet. I reapplied the tourniquet. It started working. I was afraid that, this could be an artery, because there's a difference between an artery and a vein. Now, a vein, yes, might bleed, but not like an artery, because the artery will just be pumping out. So I was just praying as I'm going, opening the layers by layer, because I wanted to identify the precise vessel that was pumping the blood. So I was lucky when I discovered that it was because it was in the elbow area, because it could be the brachial artery. And that's a very big vessel. And that will change the whole setting, because if the artery was involved, it means I have to do the repair. So when I got there, I realized that it's one of the superficial veins that were bleeding. So I just tied it. I was happy. I transfused the child with about 2 pints of blood. I didn't realize until some days later, I saw the child at the casualty, and the mother was saying, this is the doctor that did your surgery. The boy, at that time I was taking into theater, was disoriented, if you understand what it means. Meaning that he has some level of maybe hypoxia or anemia that was that bad. So he didn't recognize me, the surgeon. So I would say that's the only one that actually scared me.
Okay, for people that want to do cosmetic surgery, what are the tips that you're going to give them before seeing your doctor that I want to do a cosmetic surgery, whether a breast implant or a BBL, which is Brazilian butt lift, or a liposuction? What are the things you're going to advise patients out there or people out there before considering plastic surgery?
Well, that's a very big question, because you see, it reminded me about 3 years ago when I started this practice. I was a novice, and I do read about other people's write-up on their comments. What should they do when they are going to see a plastic surgeon? The first thing is that you have to know that the person is a plastic surgeon. That's the first step. Is this person a certified plastic surgeon? Meaning that the person has passed the board exam. The next thing is that if you want to get the best of results, you want to find out how much or how many of the same procedure as the person done. I will tell you that I have done more of liposuction, fat transfer, breast surgery, compared to somebody who is doing like a tram flap. That's what we call tram flap, which is like raising muscle and some skin to reconstruct the breast. So when they come to me, I tell them, it's not my own area of interest. Now, other thing is that for environment, you want to check their theater. You want to be sure that they have all the necessary gadgets or instruments to do their thing. Just a few things.
Welcome back. We're still talking about plastic surgery with Dr. Ayo. Going about meeting plastic surgery, lots of people believe that you have to be rich before you can afford a plastic surgery like breast lift. We are talking about cosmetic surgery. Like, how much do you charge for your breast lifts, like
You know, definitely.
all?
I will not
Because
disclose
people
any
believe you have
cost.
to have money before you can do that.
I will say you have to be comfortable. Everybody will have money, but the quantity or the amount of money you have is what matters. Now, for a lot of cosmetic surgery, I would say, for middle class, upper class citizens. Now, there are other things that people don't really understand, because sometimes I don't want to confuse people, because there's a thin line between cosmetic surgery and plastic surgery itself. If I have a child, like the smile train we have in our clinic, we have a child born with cleft lip and palate, which we do for free. They hardly pay any money to get that procedure done. Now, for someone who is coming to do breast enhancement and things like that, it means that you must have, let me use the vernacular word, eat and belly full. Do you understand? Because it's not going to do anything to you. Now, the prices range, and it depends on you. It depends on your body goal. But for a lot of time, it's people, the working class people. We had one or two students who can afford it, because their background also matters.
How much are we
No, we don't talk about price on here, but basically is like 1/3 of what is charged if you go to the US. So if you have a procedure done in the US for let's say $14,000, if you divide it by 3, or $12,000, if you divide it, so that means that we will collect like $4,000 for the same procedure. So that's what I can give as an information when it comes to pricing.
Okay, some people also believe that the silicone can also cause breast cancer.
Okay, now to answer the part of the silicone breast implants, yes, well, in the past there is no study that shows that, until recently, when the textured breast implant was discovered to cause some form of cancer. So, and immediately it was noticed, but it's only affected about 9% of people, and for a specific period of time. So immediately they noticed that that's medicine for you, including the company producing those products. They will quickly inform the doctors. They will hold seminars, they will hold teachings, and a lot of things like that, to really find out.
For something that causes cancer in 9% of individuals, do you advise people to actually do it as a surgeon?
No, I'm going to, I hope you don't mind. For a plane that crashes when it flies, should we stop flying plane? The answer is no. We can't do that. Now, even though that was discovered in certain percentage of people, it doesn't rule out, because I told you, in a particular type of breast implant, which is the textured implant, because we also have the smooth implant. So for some people don't see the difference. Some people say, oh, I prefer, before, in the past, I prefer the textured implant. But when I got that information, I started using the smooth implant. There's nothing indicating that the smooth implant can cause similar problems. So it is now left for the community of surgeons to decide on what is the way forward, how do we avoid this, when it does happen, what is the next thing to do. So that's the best way to go about it.
Another question is, men don't do plastic surgery, especially cosmetic surgery, that men don't do it. It's majorly for women that can afford it.
Well, I don't think that is true, because if you remember rightly, that Wayne Rooney had the plastic surgery done because he was bald, so he had a hair transplant. Now, the one we tend to see more in our clinic involve facial fillers, Botox, then gynecomastia, liposuction. Now, the other one, a lot of people, there's an high demand also, which we don't do, is like penile enlargement. Because we have a lot of people who always, do you do penile enlargement? Meaning that if that service is available, more people will do it. So, however, the one that is very common, and just like I said, is the cosmetic part that everybody is looking at. No, that's not true, because there are a lot of other things that affect the men. If you have an albino, a man that is an albino that has a basal cell carcinoma on the scalp, you have to excise it. That's plastic surgery. If you have a man that has a lip avulsion, maybe, or lip cancer, that's plastic surgery. If you have a child that is a boy that has undeveloped hair and is here to see you as a plastic surgery, that's plastic surgery. So there are a lot of things being done by men as plastic surgery. But however, the one in our clinic that is very common is gynecomastia. That's the men that have the female kind of breast. So that's the one that the liposuction of the abdomen is also very common.
Okay, thank you so much, Dr. Hayo. And we'll be talking more on plastic surgery. Stay with us. We'll be right back. it was on news or social media that you're the one that performed the surgery on Toto Dikete. Can you tell us more about the surgery?
Well, that, I can't answer that very particular. Yes, I'm the one that did the surgery, but the details of the surgery is between me and her. Do you understand? Yes, I did some surgery on her, but it's not more than that. Yes, we had a legal agreement and things like that to be done, but it's just that.
So for females that perform breast lift, breast augmentation, butt lift, and all those things, how do you perceive them as a male?
I don't see anything. It's just like going to the bank to pay money to my account. That's the same way I see it. Do you understand? Because people working in the bank, they can count billion. It doesn't mean it belongs to them. Those people doing those procedures, they love it. And I love it also because when I see the results and I see the joy on their faces, it brightens me. You know, when they tell me, Dr. Ayo, you know, when I went from the club, you know, people were just looking at me, you know, even sometimes, you know, like I do tell some of my staff, I said, this small fat I have in front of my own tummy, I want to lipo it. But it's going to be maybe my colleague Dr. Ladeji will be the one to do that one. So definitely you want to look good. Everybody tells you look good.
So plastic surgery, cosmetic surgery, breast lift, they are not bad.
Well, I don't know who's saying it's bad. It's a very lovely procedure and people appreciate it when you do it for them.
Okay, thank you so much, Dr. Ayo. Plastic surgery is not a bad thing. It is a very good procedure that can lift your confidence. Dr. Rasheed Ayobami has already told us a lot about plastic surgery. Men can do it, females can do it, if you can afford it, and it's cheaper doing it here than going abroad. I hope you've learned a lot on plastic surgery today on this episode. Stay tuned. Until next time, this is Health Domain.